2 American aid workers who contracted Ebola and a Spanish priest who was also diagnosed with the disease have been treated with an experimental drug, and the health of all 3 is said to be improving. But it's not known if that's solely because of the drug, which is called Zmapp. Zmapp was first identified as a drug candidate in January this year, but human trials have never been carried out. It's a mixture of 3 antibodies which are engineered to recognize Ebola and bind to infected cells so that the immune system can kill them. The company that manufactures Zmapp grows the antibodies in tobacco plants and then purifies them. But it takes several months to produce even the smallest amount of the drug. The government of Liberia says US health officials have agreed to provide sample doses of Zmapp to combat the Ebola virus. There are risks with experimental drugs, but the Liberian Information Minister, Louis Brown, says it's a risk worth taking.
The alternative to not testing this is death, is certain death, if you will. And so we know there may be risk associated with it, but choosing a risk and choosing dying, I'm sure many would prefer to choose to see that risk happen.
Ebola has a mortality rate of up to 90%. There is no cure, and the number of victims is rising all the time.